Hello and welcome. Today, we're diving into a common yet serious lung infection, pneumonia. We'll explore what it is, what causes it, how it affects your body, and most importantly, how it's treated and prevented. Join us as we unravel the complexities of pneumonia and equip you with the knowledge to understand and protect yourself and your loved ones. Pneumonia isn't caused by just one thing. It's an inflammatory condition of the lungs, most often triggered by infectious agents. Bacteria are a frequent culprit, with Streptococcus pneumonia leading the charge. Viruses, such as influenza, respiratory syncytial virus, or RSV, and even the virus that causes COVID-19 can also bring on pneumonia. Less commonly, fungi like Pneumocystis jirovecii can be responsible, particularly in individuals with weakened immune systems. Aspiration pneumonia occurs when food, liquid vomit, or other foreign material is inhaled into the lungs, causing inflammation and infection. In short, many different bugs and scenarios can lead to this lung infection. Let's see how pneumonia works in the lungs. The infectious agent reaches the small air sacs in your lungs, called alveoli. Your body's immune system responds, causing inflammation. The alveoli fill with fluid, pus, and cellular debris, a process called consolidation. This prevents efficient gas exchange. Oxygen struggles to get into your bloodstream, and carbon dioxide struggles to get out. This impaired gas exchange is what leads to many of the symptoms we'll discuss later. The infection can remain localized to a specific area of the lung, lobar pneumonia, or spread more diffusely, a bronchopneumonia. Pneumonia affects millions of people worldwide each year. It's a significant cause of morbidity and mortality, especially in young children, older adults, and individuals with underlying health conditions. The prevalence varies depending on the geographic location, time of year, and the specific causative agent. For example, influenza-related pneumonia is more common during flu season. Understanding who is most at risk helps us target prevention efforts and allocate resources effectively. The symptoms of pneumonia can vary depending on the type, severity, and the individual's overall health. Common signs and symptoms include a cough, which may produce phlegm or mucus, fever, chills, shortness of breath or difficulty breathing, chest pain that worsens when you breathe or cough, fatigue, loss of appetite, and confusion, especially in older adults. Some individuals may also experience nausea, vomiting, or diarrhea. It's important to remember that not everyone experiences all of these symptoms, and some people, particularly older adults, may have milder or atypical presentation. Diagnosing pneumonia involves a combination of medical history, physical examination, and diagnostic tests. Your doctor will listen to your lungs with a stethoscope to check for abnormal sounds like crackling or wheezing. A chest X-ray is typically performed to visualize the lungs and identify areas of consolidation or inflammation. Blood tests can help identify the infectious agent and assess the severity of the infection. In some cases, a sputum culture may be performed to identify the specific bacteria or fungi causing the pneumonia. Pulse oximetry is also used to measure the oxygen saturation in your blood. Identifying the causative agent is key to determining the best course of treatment. Pneumonia can be broadly classified based on the causative agent, such as bacterial pneumonia, viral pneumonia, fungal pneumonia, and aspiration pneumonia. Bacterial pneumonia is often further categorized by the specific bacteria involved, such as Streptococcus pneumonia or Mycoplasma pneumonia. Pneumonia can also be classified by where the infection was acquired, such as community-acquired pneumonia XAP, hospital-acquired pneumonia AP, or ventilator-associated pneumonia VAP. Understanding these classifications helps guide treatment decisions and assess the risk of complications. Treatment for pneumonia depends on the type, severity, and the individual's overall health. Bacterial pneumonia is treated with antibiotics. The specific antibiotic used will depend on the bacteria identified as the cause. Viral pneumonia may be treated with antiviral medications in some cases, but often supportive care such as rest, fluids, and pain relievers is sufficient. Fungal pneumonia is treated with antifungal medications. Aspiration pneumonia is managed with antibiotics and supportive care. Hospitalization may be necessary for severe cases or individuals with underlying health conditions. Oxygen therapy and mechanical ventilation may be required to support breathing in severe cases. It's crucial to complete the full course of antibiotics as prescribed by your doctor. Even if you start feeling better, prevention is key to reducing the burden of pneumonia. Vaccination is one of the most effective ways to prevent pneumonia, especially against Streptococcus pneumonia and influenza. The pneumococcal vaccine is recommended for children, older adults, and individuals with certain medical conditions. The annual flu vaccine is recommended for everyone 6 months of age and older. Practicing good hygiene, such as washing your hands frequently, can help prevent the spread of respiratory infections. Avoiding smoking and exposure to secondhand smoke can also reduce your risk of pneumonia. For individuals at high risk of aspiration pneumonia, such as those with swallowing difficulties, specific strategies can be implemented to reduce the risk of aspiration. The prognosis for pneumonia varies depending on the type, severity, the individual's overall health, and the timeliness of treatment. Most people with pneumonia recover fully with appropriate treatment. However, pneumonia can be life-threatening, especially in young children, older adults, and individuals with underlying health conditions. Complications of pneumonia can include sepsis, lung abscess, and respiratory failure. Current research focuses on developing new vaccines and antiviral medications, improving diagnostic methods, and optimizing treatment strategies. Studies are also investigating the long-term effects of pneumonia on lung function and overall health. Recent advances include more rapid diagnostic tests and more effective antibiotics. The development of new mRNA vaccines also holds great promise for tackling severe viral pneumonias in the future.